Bullying in Adolescents by Kristi McComas for Developmental Psychology, Psych 525. Introduction. It is important to examine the effects that cause bullying as well as the effects that bullying have on adolescents, because bullying has been known to have detrimental effects on adolescents that can affect them throughout their lifetime. The definition of adolescence is the transitional period between childhood and adulthood. There are 3 stages related to adolescence: early adolescence that takes place between 10 to 13 years old, middle adolescence that takes place between 14 and 17 years old, and late adolescence that takes place mainly between 18 and 21 years old. Bullying was defined as a repetitive intention and action to harm someone of less power. Also, it is said to be intentional harm relatively done to adolescents or adults. Bullying can be physical, sexual, or emotional. Bullying takes place in a variety of stages and settings, such as school, online, and through social media. The most influential types of bullying. Psychological cyberbullying was the most influence factor of mental health for both boys and girls. This could be due to the rise in the use of social media. The second most influential type of bullying was psychological or relational bullying, which highly correlated with mental health for both classmates and teachers bullying. The third most influential type of bullying that reflected mostly in females was sexual cyberbullying on mental health outcomes, since females are more likely to be sexually victimized than males. Physical bullying seemed to have the lowest influence on mental health. Parental influences on bullying. Some parental influences include autonomy, support, parenting styles, and parental understanding and monitoring. Fusiani et al. 2016 looked at the relation of parental autonomy support versus psychological control in regards to engagement of cyberbullying. Parental autonomy support is defined as the parents providing choices whenever possible and providing meaningful relation when the choices were limited, also meaning the promotion of adolescents' volitional functioning where the case parents were empathetic towards the adolescent's perspective. This involves the parents encouraging their children to make self-endorsed decisions which would reflect their internalized values, performance, and interests. Parental control involved the parent using manipulative and coercive tactics that involved such love as withdrawal, instilling anxiety, guilt induction, and validation of child's perspective. The research results of the study found that there was a positive direction in relation between perceived parental psychological control and cyberbullying. There was a positive relation to the satisfaction of adolescents' need for relatedness and autonomy support. If the need for autonomy was satisfied, the adolescents reported higher capacities in responding to others' emotions. This then related to their capacity to recognize civilized and moral individuals and delegitimize harm doers. The conclusion thus showed that parental psychological control directly predicted cyberbullying, where parental autonomy support was related indirectly to less bullying, which was associated with satisfaction of adolescents' need for autonomy. This then predicted more empathetic concerns towards others, and this indirectly related to recognition of humanness to victims and bullies. The next study looked at the relationship between children and of authoritative parents who support the child's autonomy that are at lower risk for bullying, and if the parents' support for child autonomy influences change in bullying over time among children with attention deficit disorder and oppositional defiant disorder in relation with children who do not have these disorders. With this, it was concluded that interventions that enhance parental support of autonomy during early school-aged adolescence may help lower the risk for later bullying. Next, the impact of Parent-adolescent bonding on school bullying and mental health in Vietnamese cultural setting. Evidence from Global School-Based Health Survey looked at describing the methods and procedures used to see if the effect of parental understanding, monitoring, and parental control associated with bonding of parents and adolescents in relation with bullying at school, such as being bullied and being physically attacked, as well as adjusting after potential confounding factors and mental health problems. In relation to parental understanding and parental monitoring, there is a significant association in reducing the likelihood that school bullying and mental health problems would take place. Parental control was associated with an increased rate of adolescents being bullied in school or having mental health problems. We will now look at the school influences on bullying. This can be determined by personal and social factors, associations with higher levels of classroom status, hierarchy in adolescence, and classroom size. It is shown that children and adolescents' bullying behavior at school is not only determined by personal factors but depends on the social context. Classroom behavioral norms, as reflected by the prevalence of bullying and/or defending behaviors, are known to influence individual bullying. The results showed that higher levels of classroom status hierarchy in adolescents were associated with higher levels of bullying. It was also shown that temporal precedence of status hierarchy over bullying behaviors, supporting the view that classroom imbalance of power facilitates the emergence of subsequential bullying. There seems to be less bullying in larger classrooms than those of smaller ones because there is said to be more of a chance for affiliation with other children in larger classrooms. So those that often do not fit in the smaller classrooms will find someone in a larger classroom that relates better with them. Consequences of bullying can include depressive symptom increase, deleterious adolescent outcomes, presence of psychological disorders, suicidal indications, and educational factors. Bullying victimization was associated with almost a twofold increase in the likelihood of depressive symptoms in adolescents. There is a relation to internalized and externalized psychological, post-traumatic stress disorder, and personality disorders, as well as suicidal behaviors in adolescents that are bullied. Bullying shows strong associations with both non-suicidal, self-injury, and suicidal behavior in these adolescents. There has also been consequences of lower educational achievement for those children that have been victims of bullying. All this information was retrieved from the study of Baer et al. 2018. Ways to help decrease bullying. In this slide, we will look at parental autonomy in relation to decreased bullying, autonomy support practices, and social support. First, we will go back to Fusciani et al. 2016, where the study concluded that parental autonomy support was related indirectly to less bullying, which was associated with the satisfaction of adolescents' need for autonomy. This then predicted more empathetic concerns towards others. This differentially related to recognition of humanness to victims and bullies, which means that with parental autonomy support, there can be a decrease in bullying. Now we'll look at Roth, Kant, Mayom, and Bibb, 2010, where they concluded that school policies should help teachers acquire autonomy support practices that focus on students' meaningful internalizations, not used on external control that involved external rewards and sanctions. For social support, it was correlated with better mental health, while buffering the negative mental health outcomes of bullying victimization. In conclusion, bullying in adolescence is a prevalent problem all over. There are many consequences such as depression, suicide, mental disorders, and a decrease in educational achievement among adolescents of bullying. Parental autonomy, parenting styles, and parenting control are all influences, along with school factors such as social factors, classroom hierarchy, and classroom size, that can affect bullying in adolescence. There have been many ways seen to decrease bullying through this research, like parental autonomy in relation to decreased bullying, autonomy support practices, and social support. It is important to look into bullying in adolescence because there is such a substantial consequence that can occur. With ways to help prevent bullying, this could lead to an increase in confidence, increased empathy, and help adolescents show support to others. This then could lead to a decrease in bullying among adolescents and decrease the impact that bullying will have on adolescents that they will face in the long run. Here are the references that were used for this presentation. References continued. Thank you so much for listening to my presentation on bullying in adolescence. Have a nice day.